Hi, my name is Callie Hatch, and I'll be doing the lab for the nose, mouth, throat, and lymphatics. Um, I just wanted to share that I've had multiple cases where I've actually had to do assessments on these areas in the last few days in the ER. I've had somebody come in with a mouth abscess that had the entire nose and mouth swollen. I also had an incident where a lady had swelling in her neck that went up to her face and into her mouth. That was of unknown cause. I've also had two patients that had Bell's palsy, so symmetry and things like that were very important. Another reason this is important for the nasal inspection is I've had to do that prior to doing an NG tube with a patient. So I'll go ahead and get along. I just wanted to share some experiences where those do occur in my real life job. So first of all, I would walk in, I would introduce myself. I would also make sure that I did hand hygiene and provided comfort for the patient. I'm going to always explain what's going to happen, especially when you're that close to somebody. You're very personal in that space when you're looking up somebody's nose and into their mouth. So first, you can walk up, and this is where all your senses are going to actually take place, not just visualization, but also you're going to touch and you're going to do odors. So people don't think about that, but oftentimes an odor from the mouth can tell you right away when there's an infection. So I just want to point that out, that you're not just using your verbal assessments, you're not just using your eyes, you're also going to use all your senses on this one. So first of all, I'd walk up, I'd look at symmetry. I'm going to look at the nose. It should be symmetrical too. I know that with muscular dystrophy, you can also have a drooping of the nose along with the lip. So that can be affected by asymmetry issues. And so the nose needs to be symmetrical. You're going to look, make sure there's no bleeding, no crust, no snot coming out of the nose. That's going to be very prevalent with children that are sick. You're going to, or if they get the, a lot of the touching type of infections that they can get around the mouth and nose, like the yellow crustiness from an infection, or you can also get the hand, mouth, and foot as well, is what I was thinking of. I'm sorry. So you're going to look at all those things right when you walk up. So symmetry, anything draining, any malformations. Patient may have a malformation due to a previous injury, such as, being hit in the nose and having a previous broken nose. You're going to look at the septum. You're going to make sure it's not deviated. You're going to look for obvious swelling, masses, lumps, things of that nature. You're going to make sure everything looks kind of midline. If it's not, you're going to ask about history, if they had previous trauma, nose jobs, things of that nature. Nose jobs can collapse, so they can cause an abnormality, even though they were meant to make the nose maybe look smaller or more symmetrical. The inside of the nose should be pink. There should be hairs in there. That's normal. Some people have more hair than others. So the other thing I like to do too, especially when I'm doing an NG tube, is then asking them to plug one side, blowing, plugging the other side and blowing, and seeing if there's a difference in the airflow in the nose. You may also audibly hear them breathing where it's making a squeak or an audible noise that's not natural, and that could tell you that there's something wrong with the nose. Then you can go down to the mouth and throat. Again, you're looking for the symmetry. I apologize. You're going to look for any swelling. You're going to look for any obvious bleeding, trauma. There can be trauma to any area in that, and they may have scars from when they had a cleft palate or things of that nature. I also then ask my patients oftentimes when I'm doing stroke scale to smile. So smile, and you count the teeth on either side. So if this is drooping, you can see only 2 teeth on that side, where on the other side you see all the teeth. You're also going to look at the teeth, see if there's missing teeth, miscolored teeth. You might see from a smile that the gums are really red or inflamed. You can see if they're swollen before you even ask them to open their mouth to look at that. You can see if there's masses or if the discoloration around the area. So then you would ask them to open their mouth. Oftentimes you want to use a tongue depressor and a pen light, and you hold the tongue down with the depressor. Normally the tongue's going to be pinkish in color. There is going to be ridges, which is normal because it's your taste buds. But if there are excessive ridges, that may be inflammation. I know that oftentimes like people have citrus allergies and their taste buds will actually get larger and inflamed. So there is a difference between just seeing taste buds or inflamed taste buds. The other thing is you're going to look at the tongue to see if there's thrush or a candida infection in the mouth. That would be like white patches or plaques on the tongue. As you're looking there too, you'll see the gum and mucosas should be pinkish or maybe darker, depending on the patient's pigmentation. Then you're also going to look at the tonsils in the back and the uvula. The uvula should be in the middle. The tonsils may be inflamed on one side and not the other. There also may be tonsil stones, which is common for people who've had their tonsils removed. There'll be like little white balls of built up food or plaque in the back, which oftentimes have an odor as well. So I oftentimes am looking at people's tonsils because I'm doing a strep test, which you have to actually get the back of the mouth. Or I've had abscesses in the palate in the top where we've actually had to go in and actually remove pus out of the top of the mouth, which was horrible for this poor person, but they can be very painful. But if that swelling gets so enlarged that it's blocking the airway, that's an emergency. If the person's drooling and they're telling you they can't swallow, that is a pertinent emergency and should be reported immediately. Swabbing the throat for the tonsils for strep throat is important because you can get scarlet fever, rheumatic fever, which can cause way more issues, cause rashes, it can cause heart issues. So really making sure you don't miss that. If the patient can't swallow, that's a problem. So look for those things when you're looking at the back of the throat. Like I said, you can stick the tongue out and ask them to move it from side to side. I've had a patient who had stroke-like symptoms, could not move the tongue to one side. So that's going to tell you about your movement and your nerve function. The other thing that we do is ask to smile. We also will ask people to scrunch to see if their features scrunch properly. You can do pursing the lips. You can ask them to say things to see if they're slurring their speech, things of that nature. Okay, so after that, the lymph nodes. So lymph nodes, oftentimes, like I said, I had a patient who had an entire swollen area here. We didn't know if it was lymph nodes or thyroid related. The patient had no history of thyroid, but had recently taken a new medication. It could be goiters, things of that nature, but you need to assess the lymph nodes to make sure. So you're going to palpate the lymph nodes here in the throat, they have in front of the ear, in the back here, the posterior cervical nodes, the subclavial nodes. If there's any weird swelling in there, that could indicate infection. It could indicate cancer, things of that nature. Any lesions should be reported. Any swelling should be reported. They could indicate more serious issues with the patient. So you're going to palpate. You can compare them. I'm sorry, I'm my own person today, so I can't do both at the same time. But you can palpate both sides at the same time to see if there's a difference. Making sure we're not occluding the carotid artery. Sorry about that. So in front here, in the back, under the chin, in front of the ear, and subclavicle. So any swelling in those areas could indicate infection within the throat and the mouth. Sometimes that's the first thing people tell me, oh, my lymph nodes right here are swollen. So make sure you assess those as well, and then search for the source of infection next. Sorry guys, I'm out of it today. It's my only day off. I apologize, it's been crazy at the ER, but hopefully that you guys got some insight on how we actually use these assessments in the ER. Thanks so much. Bye.